guys, welcome back to our YouTube channel. Today we're going to talk about heart failure, which is a so first off, I'll give you a little anatomy about the heart. The heart is divided into four chambers. There's the right, the left side, and then the right side. There's also the atrium, which is at the top, and the ventricles at the bottom. So blood that does not contain oxygen flows from all over the body, enters into the right side, it goes into the lungs will mix it with oxygen, bring it back to the left side, and then from there it will be pumped in back into our entire body or the systems. So when the heart is failing, it means that it is not able to pump enough blood out into the body so that it can meet the body's oxygen demands. There are two types, or let me say classifications, depending on where it happened or which part of the heart is failing, and also whether it is acute or chronic. And so if it happens in the right side, definitely it will be called right-sided heart failure. And then with the left, we'll call it left-sided heart failure. It can also happen in both. So usually with both, it happens when there's left-sided heart failure, and then it gradually progresses into the right side. And there are some risk factors. Some of them can be modified, some can be changed, others cannot be changed. There's nothing that you can do about those ones. And so for the ones that can be worked on, there's hypertension. So if you're hypertensive, make sure you take your drugs, eat the appropriate diet so that you can control your blood pressure. If you're also diabetic, you need to make sure that your glucose levels are normal, because if they are high, they can damage the tissues. And there's also smoking. Smoking also damages the tissues and the cells, as well as this there's obesity. And then when you have high cholesterol, the non-modifiable risk factors, which are the ones that can be changed, which are the ones that cannot be changed. There is the age. So as you get older, definitely your muscles become weaker and it affects the heart. And also gender. So they say with men, their blood vessels are bigger than that of women. And so their cholesterol, they take in more cholesterol, it tends to lie in major arteries and form plaques. And that is why they are more prone to having heart failure than women. And then another thing is family history. We all know, most of the diseases around, if you have a first generation relative, maybe your mother, your father, or your sister had it, you are more at risk of having it. And so those people should be careful with their lifestyle. There's also the race. It is more common in African Americans. The most common cause, so even after everything I've said, there are conditions or things that are very common to heart failure. And so some of the most common causes of it is coronary artery disease. When you have a problem with the arteries that are supposed to supply blood to the heart itself. Then another thing is that hypertension, uncontrolled hypertension, that is also another major factor of heart failure. Then there's also high fluid. If you have a lot of fluid in you, or if you are taking in a lot of sodium, if you have cardiac issues, and maybe a myocardial infarction or an arrhythmia, if you are stressed, if you are anemic, and if you have an infection, or if you have let me say it in a way that we understand, goiter. That means that your thyroid hormone is too much, and so you are more prone to having hypertension. So with the medication, it has to do with abuse. If you overuse them or if you overtake them, that is when you can be prone. It doesn't mean that it will cause it, but it will put you at more risk of developing signs and symptoms, or as we call it in the clinical setting, clinical manifestation. So when I was talking about the anatomy, I said that the right side takes the blood from every part of our body, the blood that doesn't contain oxygen, and sends it into the lungs. And so if there's a problem with the right side, that means that blood will not be able to be pumped into the lungs and to the left side, then into the entire circulation. So whatever blood that is coming there will have to go back to wherever it's coming from. And so for that reason, those people become swollen, or they swell up. And the blood backs up into the liver, into the spleen, into our peripheries, especially the feet, and then the veins here. It's called jugular vein. And so for them, you see they have the jugular vein distension. They also have splenomegaly. They will have hepatomegaly. That means hepato means that the liver has become big. Splenomegaly means the spleen has become big. They will also have edema in their feet. And they will have ascites. Ascites is when there's fluid in your abdomen. And that is all as a result, can be as a result of right-sided heart failure. And then when it comes to the heart, because the blood will enter the lungs and then into the left side, when it comes to the left side, the symptoms are more related with the lungs, issues of breathing. So those people, they have shortness of breath, they have difficulty breathing. When they lie down, they can't breathe well. So you always see them sitting up or being in an upright position. They will also have, when you listen to the chest, because the fluid is built up in the chest, you hear crackles, so like water moving in the chest. They also cough, trying to bring something out, but the cough is usually. And then another thing is that they'll try to breathe more, to take in more. So their heart rate, their respiratory rate is always very high, and that is what we call tachypnea. Because they are not getting enough oxygenated blood to their system, they become tired easily, to fatigue. And then another thing is that they become cyanide. That is when they become bluish. So their lips, your nails, your finger, they all become bluish. That means you are not getting enough oxygen to those parts. And another, the cough, especially the cough usually happens in the, for the diagnostics, or for the things they do to determine if you have heart failure or not. You can do electrocardiogram, you can do echocardiogram. So echocardiogram will let us know the sizes or the thickness of the heart chambers in the walls. And then the electrocardiogram will let us know if you have any coronary artery disease that is causing the heart failure. And then they also do another test called brain natriuretic peptide, and this is done to determine how much the heart and the heart ventricles are being the heart is failing. And then for the management, there's pharmacological management and then non-pharmacological management. So we'll deal with the ones that is non-pharmacological. That means you don't treat it with drugs. So with this, you treat it with diet. So you have to watch your salt intake. Don't take in a lot of salt. So don't take in canned products and processed meat. Canned products have a lot of salt. Then you also have to watch how much fluid you take. I know we say we're supposed to drink in a lot of fluid every day, like 3 liters, 8 cups. No, for people with heart failure, they're supposed to restrict it. I think 2 liters is okay for a day. And then we also have to control all the signs and symptoms that come with heart failure. So asymptomatic treatment. So if you lie down and you feel like you can't breathe, don't lie down when you are sleeping. Use pillows to support your back so that you can be upright, so you can breathe very well. You also need to exercise, but not any strenuous. You can probably take a walk or just jog around if you feel you can. And if you are tired, you take a rest. Do not strain yourself so much. And for the pharmacological treat, about 5 types or classes of medications. The inhibitors. Those ones are the lisinopril, ramipril. Those ones, if you take them and you're having dry cough, and then there's also ARBs. Those ones are losartan and valsartan and all those. ACE and ARBs are Then there's also the beta blockers like the bisoprolol, carvedilol. Beta blockers also decreases the BP, and it also has an effect on the heart rate. Another thing is that they'll give you diuretics. So diuretics are taken so that you can urinate more. So if you have fluid building up, they'll give you that. They also call it water pill. So if you urinate, that means that it brings the pressure on the heart down. Then there's also digoxin. Digoxin is also given so per all the symptoms that I have said, if you experience any of those things, please do not stay in the house. It will be appropriate, or it will be very helpful for you to go to the nearest hospital for treatment. Thank you. If you want more of this, subscribe, like, share, and click on the notification button. Okay, see you next time. Bye.